Hello, and welcome back to the second episode of Genetics and the Heart, the future of cardiovascular care. I remain your host, Uchenna Amadi, and I am with the amazing Dr. Udu Ikem G, MD, Senior Clinical Coordinator and Cardiovascular Specialist at Lagos Executive Cardiovascular Center. Nice to have you here again.
Thank you.
Dr. Ikem, I remember that you said you're a music enthusiast. So I am very interested because I have an old school music lover at home. So what kind of music do you enjoy?
Okay. Before now, I used to enjoy everything music as long as it has
You did not have
has
direction.
good beats. But
Okay.
but now I am much more focused in my genre of music.
Which is?
Okay, I love hip hop. I love blues, and I love classical.
I can understand the blues. It goes with your the hip hop part.
Classical.
I am trying hard.
Trying hard. Well, let me say, I'm also surprised.
You're surprised. Okay, that's nice. Once again, a pleasure to have you here.
Thank you.
So in the first episode, our focus was on what your DNA says about your heart, understanding cardiovascular genetic markers, and the doctor did justice to my questions. It was an insightful episode. Please, if you've not watched it, you need to go back and watch it. But in this episode, we shall be discussing on behind the lab doors, how pathologists unlock genetic clues for heart health. Wow, I love these topics. Once again, do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and on Spotify. Okay, Dr. Ikem, let's talk about ensuring accuracy and reliability. So how do you ensure the accuracy, reliability, and clinical relevance of cardiovascular genetic test results?
Okay. For the relevance, the relevance is very simple because it's we that are going to make it relevant as with the medical practitioners. The more we request for this test, the more we sensitize people to do it and know about it, the more relevant it becomes.
Okay.
Just like back then when paternity test was least talked about, any picking where your wife won't give you a collect them, you don't go ask questions, you just collect
Now
them.
people are asking questions.
Exactly.
Everybody
people are
I
now
know
asking
open.
questions. So when we start talking about it, it becomes relevant.
Yeah.
Then the other one, the accuracy. I'm sure the accuracy will not be in contest if we have labs like Synlab diving into it. Synlab is very reputable, and once they take on it, I'm sure I wouldn't have any reason to doubt the accuracy of the results when they must have been carried out in such labs. So for the accuracy, it's about a synergy between the clinicians and the laboratory specialist as well, so we can come up with a much more accurate and formidable outcome.
Okay, thank you for how you did justice to that. Speaking of the common genetic variants, what are the most common genetic variants you look for when assessing cardiovascular risk?
Okay, genetic variants are very, very widespread, and sorry, excuse me. In assessing,
No problem.
In assessing cardiovascular risk, there are lots of genetic variants one could think of, and one of them, like I talked about, is the hypercholesterolemia thing. It's a very, very important variant because the way cholesterol builds up in your body is such that, okay, you've seen this tug of war thing where people drag from both ends of a rope. So as this part is dragging, the other end is dragging. So let's put the heart at the center of this dragging. So both ends of the vessels are dragging and pulling on the heart, creating unnecessary tension on the heart. So the heart is trying to push against those resistance built by those ends of the dragon. And then it might end up overworking itself. So one of the variants is the hypercholesterolemia. So people should mind what they eat, because there's this saying that you are what you eat.
Mm-hmm.
I know a lot of people love junks. It's readily available. In fact, there is this period carbonated drink was a very serious trend, even to the extent that the Coca-Cola company had to produce 1 liter of Coke and Fanta.
Yeah.
So people wanted to take a whole lot of it at a time. It was really, really crazy. So that's one aspect people need to look into, the dieting, which could skyrocket the cholesterol levels in the blood. Then the other variant we also need to talk about is the cardiac biomarkers. The cardiac biomarkers. Those ones are the very silent ones, the troponin, the CKMB, because chest pain is becoming a common thing, especially amongst just young people. I can speak from experience. The number of people I've seen coming down with chest pain. And then most of them think is acid reflux. That's GERD, having acid from your stomach down up to your throat. It could cause chest pain, yes. But then that's not the only thing that could cause chest pain. You also need to check for these troponin and CKMB. They are biomarkers. Let's not go too far because it might confuse some of our audience. So that's one of that variant we need to look into. And generally speaking, we just need to find a spectrum. It's not a part. It's not a point. The checking for the variant is not a point thing. It's a spectrum from one end to the other, from the dieting to the family history and to the exercising. All of them are contributory. So when one needs to check for the genetic predispositions to a particular disease, they need to find individualized risk factors. Now, someone that has a particular condition, say obesity, someone that is obese, that has a lot of body mass.
I'm even going to pick your brains on, you mentioned exercise. So I was going to ask after this though about cardio and what's it called? Brisk walking. But let me know, ruin the line of gist for now.
Okay, so no problem. So for someone that has for someone that is obese, for instance, the person going to the hospital, one of the major things they should check is their level of cholesterol, because most times some of these body fats they could dislodge from their peripheral deposition sites to the vessels. So the person need not checking out any other thing. You don't need to go to space. Just start with the basics. So most times they are just here with us. We just don't think of them. We want to think abstractly, and it's not helping. So we need to start from home.
Okay, so let me talk about that, the exercise part, the
okay.
fitness part. So digressing a bit, would you rather a cardio than a brisk walk?
Okay,
because mostly let me throw shades on these our gym brothers that used to go every time. Yeah. What is that doing for them? So in your opinion, what do you think?
That's really, really important, because exercises are very different. As someone that is not, when you go to the gym, it's not every form of exercise you need to register for. Or
Please help me tell them.
Or anything you see people doing, you want to go and do. You see people losing belly fat.
I'm tempted to call names, but I'll not call.
Don't shake that table. So people need to know that their exercise should be tailored to their condition.
Thank you. Tailor it, please.
Tailor it to your condition. Yes. If you see someone going to the gym, someone that wants, let's say, someone that wants to build their ass, for ladies, you see them squatting. You are someone that needs to help your cardiovascular health. You don't need squatting for anything, auntie. You don't need you want to build you want to cut your belly fats, want to reduce your belly fats, and you have a cardiovascular condition. You don't need to do certain things. Okay, number one is that WHO has recommended 15 to 30 minutes brisk walk daily for people who have cardiovascular conditions. So walking, running helps. I don't know why you want to go and start lifting weights. Is your heart here? Why want to go and start lifting weights? So you need to find the one that is individualized to your condition.
Yeah.
So for every cardio condition, we recommend brisk walking or running. Don't even need all those heavy weightlifting because you're even building more pressure on your heart. So you don't need all those for yourself. So before you register for any gym activity, you need to consult your cardiologist and get the one that is adequate for you. I'm speaking to the ladies in particular.
No, speak to the men too. What is that?
Yeah, the men. But mostly the ladies, please.
Yeah.
They're the ones that do that a lot.
Okay. We'll take this fight out of this, please, after now. But thank you for clarifying. Just for those that are listening, please, you have heard what the doctor said. So let me quickly talk about interpreting complex genetic results. What are the biggest challenges you face when doing that?
Complex genetic results. Okay, yeah. So the genetic testing thing is not without challenge. It has its own downsides as well. Because most times, like I said, the genetic testing only tells you about the risk of a patient or of an individual to having cardiovascular disease. So most of the challenges we have is that you tell someone that they have a risk of having cardiovascular disease, and then the person comes back in 60, 70 years telling you that, see, I don't have anything. So they think you told them a lie. Remember I told you at the beginning that genetic testing only tells you a possibility. It doesn't tell you in certainty that someone would have a cardiovascular disease. So they feel like the genetic testing is baseless when they must have grown old and then they don't have these conditions. I read a literature when someone was asked to be careful of the things they do, eat, and things they eat, and then have a healthy exercising. So the man was 35 at the time. So he came back later to the hospital at 80. And then he told the doctor that his blood pressure is fine. He has been avoiding all the things they said he should avoid. But then he doesn't have any cardiovascular disease. So they said the man went out the next day to go and he went to buy all forms of junk. He started living his life anyhow because
they told him he does not have.
Do you understand? Wow. So they said that in 3 months' time, the man died. Not because he had an accident, but because he had a stroke. The cholesterol built up really fast and then dislodged and went to his brain. And he had a stroke. From the stroke, I think he also had pulmonary embolism as well. That was the one that killed him. So sometimes it's important to adhere to the specifications of this genetic testing. Not because they are going to kill you. They are not going to. No, not because they tell you about the risk or the possibilities only, but because you don't know what could happen the next second. So the fact that it tells you that you're just having a risk doesn't mean that you cannot come down with it before the specified time. Because sometimes it also doesn't tell us the time. It has its limitations. Yes, we all agree. Has its limitations because it doesn't tell you the time frame or the period when the manifestations would happen. But then it tells you that there's a possibility, there's a warning sign. There's a warning sign. Just like having a traffic light on the road, the streets of Lagos. Most people don't keep to the traffic rules, yes. But then the traffic light would say yellow and then red. Red means stop. Sometimes you move and nothing happens, and some other times you move and then you hit someone's car. So that's how these things can be. You could live your life normally, and sometimes you default, and then
just that one time that you default.
Do you understand?
Wow.
So you can never really tell what happens next. So just be careful and adhere to whatever advice you're giving about your lifestyle and your diet based on the results of genetic testing.
But why would somebody, because the results came out a certain way, you now decided to go and buy?
I don't
One
know.
thing must kill a man and you ran with the vision.
Probably the man
Wow.
must have endured not eating all those things he loved eating for the
That's a
60
risk.
or 50 years he lived
Wow.
without them. Who knows? I don't know.
Wow.
So, but then sweet things kill. I remember one patient I was counseling on taking away the back of the chicken. After frying the chicken, take away the back. If you must eat chicken, just eat the inside. And reducing junks, reducing carbs. I was like, doctor, you are taking away all the good stuff. So what's remaining? So I'm like, the good stuff are the things that are going to kill you. So just avoid the good stuff. Not like the other ones are bad, but then good sweet things kill.
Wow.
Sweet things kill. So just try to avoid.
Wow, thank you for doing justice to that. You know, we just talked about interpreting complex genetic results. Let's talk about the sensitive ones. How do you handle sensitive or unexpected findings that may have implications beyond the heart? So beyond the,
Okay.
You don't pass heart, they go where you know.
No. Okay. First of all, it's like you said, it's sensitive. So breaking this sensitive news to patients can also be challenging in itself. So sometimes patients don't want to hear the bad news, but then you try as much as possible to break it to them in a very palatable way. And then both of you
How can it be palatable?
That's why you try.
Oh, wow.
That's why you try.
Wow.
So it might not seem, the news itself might not be palatable, but then the way you arrive at breaking the news, at least you start with the good news. The good news is that you are still alive and that you came to the hospital and then there is hope for you. But then the bad news is that, Omo, you have to you have to take some precautions and you have to live with this for the rest of your life. Not that you are alone in this, but we are here to support you every step of the way. So that way it comes off a little easy and the person is relaxed and knows that you are there for him or her. So that is one aspect. And sometimes also, like you said, it could go beyond the heart to other parts of the body, like even involving the brain, the kidneys, and the liver, and other parts of the body. So what we do usually is that we try to involve other specialists, because at that point it's already multidisciplinary. So, but before you involve other specialists, breaking the news is one important aspect. Breaking bad news has never been a very wonderful experience for me. Breaking bad news is one of the most difficult aspects of my practice. I can confess to that. But then at the end of the day, you just find out that some of these patients are already anticipating it. They just want you to say it, but it's how you say it that matters. I remember having an experience with one patient who told me that the hospital she's coming from, that after, while she was discussing with the doctors there, and they told her that she had, I think, heart failure. And then she was not asking to find out how she can go about it. So they told her to go to a particular center to do some cardiac investigations, imaging. So she said that she preferred a particular one. So ideally, some patients have preferences for some institutions for their imaging. So she said that the doctor insisted on a particular institution for the imaging, probably because it was the best for her. So she said she wanted the other one because it was closer to her. So the doctor said that it's your life. You can do with it whatever you like. How you can do with it whatever you like, yes. And then if you like, go there and then they will give you something that will kill you. So like she was thrown off. So she came complaining that, I mean, someone should not use such words on her, because I mean she was already passing through a lot having the condition. So in such situations, you just have to be as soft and as sweet as possible, making them understand that you feel their pain. There's a difference between empathy and sympathy. Sympathy is you just trying to, without offering solution. But empathy is that
you're putting yourself in
and
their shoes.
Yes, and you're trying to proffer a solution to the problem, not just crying and trying to beat up yourself that they have this condition without doing anything. You're just making noise. So you need to also put yourself in their shoes and understand that, anybody could pass through this. It could be you, could be them, could be anybody. So empathy is really important. So I breaking the news.
Of
That's
course.
one important thing I wanted to emphasize. And
Okay.
then to the patient, it's also be hopeful to say that this realization sometimes it is not the end of the world, or these discoveries, they are not the end of the world. I'm just putting it out there to all patients who must have had one cardiovascular condition or the other. Yeah, the world has really evolved, and I want you to know that there are many, many innovations out there for you, especially if you have heart failure, if you have a myocardial infarction, if you have hypertension, if you have all sorts of cardiovascular diseases. There are lots of innovations out there to help you cope with whatever condition.
Since we started this discussion, I've been wondering, how does one prepare for genetic testing? If I wanted to go for,
Okay.
what's any advisory, precautionary measures? What am I supposed to do? Am I supposed to eat? Am I supposed to appear like that? Mentally as well.
Okay. The most important preparation is the mental
Yeah.
preparation. Like every other test, you just go and then they take some samples and then they run the test. But then in genetic testing, you're meant to be very mentally prepared, because one is that you're already scared of the outcome, because
Yeah.
it's a screening test, and just like going for HIV screening.
I was about to mention it too.
Just like going
The
for
way you go for fasting blood sugar is not the way you go for HIV
You
test.
understand? When you go for HIV
Even if you know you're fine.
I'm telling you. So
You have to just
exactly.
Yeah.
So that's why I mentioned the mental preparation. It's really, really important, because you're already scared of the outcome. No, this one is not like HIV test. In HIV test, you already know that you must have done something that could predispose you to having the HIV.
Yeah.
But in genetic testing,
you never do anything.
do you understand?
You were
You've
just
not done
existing.
anything. You're on your own, and then suddenly, boom! They tell you that
Wow.
you have this condition. It can be so distraught, and it can be mind blowing.
Wow.
So that's why you need to be mentally ready. You don't need to just present yourself and then they do their thing.
Okay. Let's go to speaking of ethics. What ethical considerations arise when dealing with genetic information, especially diseases that may not yet be symptomatic?
Okay. Yeah. There are a lot of medical legal issues surrounding this particular one, because many people don't consent to genetic testing yet. Why? Because they feel the results are not accurate.
Okay.
Especially in this part of the world.
Oh, wow.
Out there in the Western world, it's very, very common, because people do it, and it's now a norm. Like I told you about the paternity testing, people do it rampantly now, and it's generally, people know about it. The awareness is over the place. But then for these cardiovascular genetic testing, most people don't know about it yet. So people don't consent to what they don't know about.
Yeah.
That is one.
Yeah.
And then secondly, even when they know about it, most times when the outcome is not palatable, they want to dissociate from it or put out a disclaimer.
Yeah.
So that's one of the reasons people don't consent to it. But then there are still people who do it, and most people that do it, and they understand that there could be a connection to their family history, they accept it, and I mean, with the avoidance of some of the risk factors, they live fine. So everybody cannot accept it at this point in time until it becomes popularized. That's why we need to popularize it, talk more about it, so that people get to know what genetic testing for cardiovascular diseases are, and then they key in, and at the end of the day, I think everybody will be fine. But there are lots of people who want to make issues out of it, especially when they feel that some of the samples taken for the genetic testing wear and tears. So they make a fuss of it. And it's important to also point out that you cannot see what you like in genetic testing results. You cannot see what you like. Even if your father or your mother or someone in your family did not have a predisposition to cardiovascular diseases, it's possible you could have it.
Okay.
Genetic testing makes it, it's not that genetic testing makes it possible, but the results or the outcome might not be what you expect.
Yeah.
Might not be. That's the beauty of genetic testing, because if
How is that a beauty?
no, it's beautiful because if you know that your father or your mother had a cardiovascular disease and you're already going for the genetic testing, you already know what you're expecting.
Yeah.
But then, in fact, most people will not even want to do it since they know that their father or their mother had a particular
they've just
cardiovascular
prepared
disease.
their minds.
But then you just go because you think that you might have it, or your doctor asked you to do it, and then your parents don't have it. And then the result comes out. It will be beneficial to you at that point because you know that, I wouldn't have found this out in any way because there was no indication from my family. So that's why I said it's beautiful, because it helps to prevent a lot of things, even when you don't know.
Yeah. So you mentioned something about samples. So what sort of samples do they take from patients for genetic testing?
Okay. They take sometimes they take blood samples, and they could take sputum.
Okay.
They could take some how do you put it? They could take biopsies of your myocytes, the cardiac muscles, to do some of these testings as well. So there are lots of samples, but these are the common, readily available ones for now.
So when you say sputum, you mean for our non-medical audience?
Okay, sorry. I forgot. I was talking to everybody. So for the sputum, it's a concentrated saliva. It's not just saliva.
So do you have to brush before that is it?
If you've not been brushing, just don't brush. Just don't brush that day.
The collectors. Nose mask.
Don't pretend about it. Just go the way you are.
Come as you are.
Come as you are.
Oh, wow, Dr. Ikem, this has actually been very enlightening, and I'm truly grateful to have you here today. Well, listeners, there you have it. Sadly, we have come to the end of this insightful journey.
Sadly.
Yeah. And I'd like to appreciate you for staying with us. A huge thank you once again to Dr. Udu Ikem for being here today and for sharing his knowledge with us. And thank you once again, my listeners, for joining us on this journey into the heart of genetics, from uncovering what your DNA reveals about your heart to exploring how pathologists decode these genetic clues. It is clear that the future of your heart health is deeply personal. Please stay informed, stay heart healthy. Do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and on Spotify. You can also follow Synlab Nigeria across all social media platforms. Thank you once again for listening in. My name is Uchenna Amadi, and I'm signing off.